Welcome. I hope everyone is comfortably seated and can hear me. I hear that I see one text to me that we're live, and if anyone can see that, yeah, great, I can hear you, can hear me. Wonderful. So that makes me feel much better. So welcome, everyone. My name is Jonathan Damonte, and I'm here to present to you about Bowen Therapy and specifically how and why we work on the feet and how wonderfully effective Bowen Therapy can be for foot problems. So I think that I'll start by telling you a little bit about myself and the agenda today. I think you can probably see in the chat icon to the right of your screen the agenda. And I'm just going to do a little intro, and we're going to talk about why Bowen, why the title of the webinar. We're going to watch a little live demonstration and see an interview with a patient and see the treatment on their feet. It won't show the entire Bowen treatment, but specifically to the feet. We can watch some other videos if we have time and if they sound good. I would also, someone says my voice is echoing. So I'm going to step back from the camera a second and just double check. This is a awkward part of the seminar where we need to just make sure that we've got, yeah, this is the best I can do, I think. I've had some problems. So let me know, Brenda, if you're hearing me better now. I will try and speak more monotone and consistently. So give me another text if it's still a problem. Okay, so I think a little bit about myself would be important to know why and how I ended up being in front of you in this situation. This is the first webinar. I hope it's going to be successful and that we will be able to do more. I already have a title for the next one, so let's hope there's some positive feedback. The message I got was that it's not too loud for some people, but you might be having your volume set too high, and that could be the problem. So Brenda, try reducing your volume and let me know if it's still a problem. Great. So my initial exposure to Bowen Therapy came from a treatment that was given me, and this happened in 1999, so it's 15 years ago now. I had a colleague who had learned the therapy or was learning the therapy, and I had had a chronic hip and back issue my entire life. I was a breech birth and a natural birth. So in those days, I think they weren't as careful with how they managed the newborns and their hip dysplasia. And I certainly had that. And what was a lifelong struggle of many, many different types of therapies and treatments to help and address my constant chronic pain was actually relieved just after one visit. And, you know, it was so remarkable. It was actually unremarkable. It was just so automatically better that you just didn't even think about it anymore. And it's only now when I talk about it that I actually realize what an impact it was to have pain chronically and then have it switched off. But what evolved from that experience was sending people to that practitioner for anyone who had physical pain, misalignment, who needed basically physical therapy. It was the best option that I had around for me, and it was a remarkable thing to witness how many people got such quick relief. I was a happy homeopath, studiously studying books and very cerebral process is what homeopathy involves. And I didn't really have an interest in doing body work. I really wasn't interested in touching anyone, but circumstances changed and I had to learn to do it. There was a demand, and so I took a course with an Australian man named Ozzy Wrench, and that got me started. And now I am, 15 years later, it's the majority of what I do in my clinic. I still practice homeopathy a lot, but the majority of patients that come to see me come for referrals of Bowen Therapy. They come word of mouth, and one of the principal ways that people are amazed by Bowen Therapy is through the footwork procedures and the taping that we use to apply and benefit. Welcome. I hope everyone is comfortably seated and can hear me. I hear that I see one text to me that we're live, and if anyone can see that, yeah, great, I can hear you, can hear me, wonderful. So that makes me feel much better. So welcome everyone. My name is Jonathan Damonte, and I'm here to present to you about Bowen Therapy and specifically how and why we work on the feet and how wonderfully effective Bowen Therapy can be for foot problems. So I think that I'll start by telling you a little bit about myself and the agenda today. I think you can probably see in the chat icon to the right of your screen the agenda. And I'm just going to do a little intro, and we're going to talk about why Bowen, why the title of the webinar. We're going to watch a little live demonstration and see an interview with a patient and see the treatment on their feet. It won't show the entire Bowen treatment, but specifically to the feet. We can watch some other videos if we have time and if they sound good. I would also, someone says my voice is echoing. So I'm going to step back from the camera a second and just double check. This is a awkward part of the seminar where we need to just make sure that we've got, yeah, this is the best I can do, I think. I've had some problems. So let me know, Brenda, if you're hearing me better now. I will try and speak more monotone and consistently. So give me another text if it's still a problem. Okay, so I think a little bit about myself would be important to know why and how I ended up being in front of you in this situation. This is the first webinar. I hope it's going to be successful and that we will be able to do more. I already have a title for the next one, so let's hope there's some positive feedback. The message I got was that it's not too loud for some people, but you might be having your volume set too high, and that could be the problem. So Brenda, try reducing your volume and let me know if it's still a problem. Great. So my initial exposure to Bowen Therapy came from a treatment that was given me, and this happened in 1999, so it's 15 years ago now. I had a colleague who had learned the therapy or was learning the therapy, and I had had a chronic hip and back issue my entire life. I was a breech birth and a natural birth. So in those days, I think they weren't as careful with how they managed the newborns and their hip dysplasia. And I certainly had that. And what was a lifelong struggle of many, many different types of therapies and treatments to help and address my constant chronic pain was actually relieved just after one visit. And, you know, it was so remarkable. It was actually unremarkable. It was just so automatically better that you just didn't even think about it anymore. And it's only now when I talk about it that I actually realize what an impact it was to have pain chronically and then have it switched off. But what evolved from that experience was sending people to that practitioner for anyone who had physical pain, misalignment, who needed basically physical therapy. It was the best option that I had around for me, and it was a remarkable thing to witness how many people got such quick relief. I was a happy homeopath, studiously studying books and very cerebral process is what homeopathy involves. And I didn't really have an interest in doing body work. I really wasn't interested in touching anyone. But circumstances changed and I had to learn to do it. There was a demand, and so I took a course with an Australian man named Ozzy Wrench, and that got me started. And now I am, 15 years later, it's the majority of what I do in my clinic. I still practice homeopathy a lot, but the majority of patients that come to see me come for referrals of Bowen therapy. They come word of mouth, and one of the principal ways that people are amazed by Bowen therapy is through the footwork procedures and the taping that we use to apply and benefit the treatment that we do. When we work on feet, we don't just work on feet in isolation, as may appear in this video, or webinar, I should call it, but we work on the whole entire body, the whole entire alignment of the body, and we'll talk about that as we go along. So what you'll see in this webinar is primarily treatments of the feet, and it's a method of, it's a webinar of how to treat the feet, not how to do Bowen therapy. So in the future, I hope to do more videos. And of course, many of you know that I have a website called Bowen-Online, which offers video classes. And also I teach Bowen therapy as well. I'm actually broadcasting today from Vancouver, Canada. And I know that many, many people from around the world will be watching this. And so it's very exciting that the first webinar got such a huge response. There are more than 350 people registered. I'm sure that there's quite a few less than that here, but everyone will be able to watch the video once the webinar is finished. Great. So I started my practice in Nova Scotia and then moved to Toronto. And one of my clinics was in the shopping area called Yorkville and Cumberland. And it was actually on Bel Air, one of the streets there. It's a very slick and, I should say slick, but swanky neighborhood. Lots of expensive shops and boutiques and stylists. And one of the clients came to me for a back problem, and it was springtime. She was well dressed, and she was wearing open-toed sandals. And I observed them and mentioned to her that there's some therapies that I'd like to try to treat her feet. And I did them with great results, got an enormous amount of referrals from her, as she was one of the top stylists, hairstylists in the area. And so I ended up treating a lot of hammer toes, plantar fasciitis, and just general prolapsed feet. It was a very important part of people's appearance, and it got me very, very busy, and I got a lot of practice at it. And now, 15 years later, I still work on feet a tremendous amount. It's an important part of treating someone. Our feet accommodate our posture elsewhere, and vice versa. So the feet become an integral part of overall treatment with Bowen therapy. So I'd like to switch now to a slideshow, and because this is a live webinar and this is my first one, there's a lot of technical issues, and it may not go so smoothly. So you may see some psychedelic images on the screen, but don't worry, you'll get to the part where we need to see things pretty soon. So I'll just share the entire computer. I'm going to present to everyone, and now I do hope that everyone will be able to hear me still, and I assume so. I'm going to now talk about the Bowen therapy for feet through the presentation that I've prepared. So it's all about the foot, said the hip to the knee, and I think a lot of you understood the meaning of that, and I think it's pretty self-explanatory. But as mentioned, really importantly, when addressing the feet, we absolutely have to address how the body is standing on the hips or sitting on the hips, just positioning itself on the hips in relation to the alignment of the spine, the muscles of the back, the shoulders, the neck, and then the sacrum, the coccyx. All of these need to be symmetrical. If they are misaligned, if there are deviations in the symmetry of muscle groups and joint alignment, then that will be manifest in the way the foot functions, and vice versa. If the feet are troubled and you have misalignment in them, perhaps toes that misshape, bunions that have formed, this will affect the knee, and it will affect the hip alignment, and that will affect the sacral, iliac alignment, and then the spine, and then the neck. And, many clients come to Bowen Therapy with an ache or pain in one part of their body that sometimes isn't actually the problem itself. It's the accommodation to the problem. So as a Bowen therapist, you're unraveling is accommodating itself and from its traumas, from its injuries. And there's a lot to work on. And it's a good thing that Bowen Therapy is such an efficient tool. It's very clearly working in very few visits. So I'm just going to check my phone and make sure no one's texting me to say that nothing's working. And I don't see any messages. So looks like we're live and doing well. So to move on, a little bit of an agenda, the intro and why the title. And I'm going to show shortly a video demonstration, and then we'll look at the particulars of the method and how and why Bowen Therapy works. We're going to look at how to treat the feet. I'm going to give you some resources. We'll have some time for questions and answers, and then a last word from me, I guess, in relation to the questions and answers and anything that might come up. So wonderful. I'm going to now switch screens to a video, and I will say that in this setup, the video may have some sound difficulties. It's a webinar. It's not really designed for working with live video, and so we'll see how that works. So here we go. A little video demonstration. I'm going to talk a little bit and then let the voice of the demonstration speak for itself. So this is a lady named Linda, and she came a few weeks ago with x-rays and ankle pain along with hammer toes and bunions. Now, the right foot was surgically treated, but the left foot and the right foot both needed a lot of treatment. Now she's going to talk and explain her story. Helping explain what's been good for therapy.
Yes.
So this is 2 weeks break since you were in last.
Yeah.
And so far things were going well when last I saw you.
Yeah.
But just for the record, do you mind telling me what had happened to your feet and why you came to see me?
About 4 years ago, I mean, I've always had a bunion. They've told me for years that I was probably going to start to bother me, but it never really bothered me until 4 years ago. I hit my second toe, like I stubbed it, and it crossed over my big toe. And like it started causing pain to put shoes on or whatever, and it was just, I couldn't straighten it out for anything, so I would tape it. I taped it with Band-Aids, tried to straighten it out, keeping it away but I still got pain from it, and it was, like I said, wearing shoes was an awful pain. So I went to see my GP first, and then he sent me to an orthopedic surgeon, and I had surgery I guess this March will be 2 years. And I've had chronic ankle pain ever since. And that's why I'm here to see and it has made a big difference, really.
And then also your other foot.
Yes.
Experiencing that.
That's right. My other foot is starting to cross. And I've got like hammer toes, and it's the same thing, starting to bother me when I wear shoes. But now, it's like, and it was starting to cross, but ever since I've had the treatment, my toes are getting a little bit straighter.
Great. And with the 2 week break that we had, did that
yes,
also remain the same?
It did. They stay straight when I'm walking, but if I try and, like I do a lot of yoga, and when I do the yoga poses, the toe starts to cross a little bit, but not as bad as it used to.
Okay. that's wonderful. So we've seen your x-rays, and maybe we could take a view of your feet before we work.
Okay.
And you were mentioning as well how the ankle pain becomes more of a shooting sensation now. So
Yes.
the last time I taped your ankle, did that give support for an amount of time?
Yes, like while it was taped, it was great.
Yeah.
And then I kept it on for the tape on for about 36 hours. And then when I took it off, the ankle pain was pretty bad to start off with, but it got better pretty well. Like it lasted for about 20 minutes, the pain, and then it dissipated. And then the next day when I worked standing up all day, at the end of the day, it was much better than before. But I like working with the tape on my feet, that's for sure. It makes a difference.
Yeah. I mean, one of the things is you are wearing some insoles.
Yes, I wear the Dr. Scholl's half insoles. Yeah. And I have 2 pairs of those, but I change my shoes pretty well every day. I just try and wear something different every day.
Yeah. Okay, that's good. And I think that, I think that's a really good approach for sure.
Yeah.
Okay, let's have, I'll just take the camera and take your feet now, so that we can see how they are without the tape on. It's great. So the right foot is what had the surgery.
Yes, this foot had the surgery. Yeah. This toe completely went over this way. And now it's straight from the surgery, but now I have like a swollen ankle.
Yeah.
And it's basically giving me chronic pain in here. Like I get shooting pain up through here, and that's where the shooting pain is, and then like more of a chronic pain that is in this area here.
And that's like an ache.
Yes.
Okay. And then
but that ache is gone since I've had your treatments.
With shoes, different heights of heel, what's the best and most comfortable?
Something like this. Something along these lines, like a half an inch to a 1 inch heel. If I go any higher, which I did about a week ago, I did about a 2.5 inch heel. No, didn't like that very much at all. So I keep with the lower heels. It's much better.
Okay, so I'll just talk it through, that way everyone will understand it. So move 1 is over hallucis longus extensor. Move 2 is going to go from the distal end of the malleolus through the groove between the malleolus and the talus. So we take skin onto the malleoli, challenge, and move through the groove. And then we return, take skin towards the top of the foot, challenge, and move through the groove toward the calcaneus. Leave the finger there, and then on the opposite side, between the groove as well, we're going to position the thumb pad, taking slack towards the top of the foot, challenge into the groove between the medial malleolus and the talus, and move through over the ligaments. Very simple. Now these fingers become holding points, and we leave them exactly where we did the moves. So we're touching both the malleolus above and the talus below. We're right in the middle, and this becomes a fulcrum for our flexing of the joint of the foot. Challenge fully by stressing the foot and the ankle joint, and then a final push beyond the flexion of the ankle joint. So that's the ankle procedure. Now the hammer toe procedure, we're going to take thumbs into the middle of the ball of the foot, slack towards the heel, challenge, and then move toward the toes. And now with the fingers on the underside of the metatarsals and the thumbs just sitting above, we can flex the joint comfortably from the big toe to the little toe. And You only need to do this once from the big toe to the little toe and then back again. Really stretching the skin over the joint of the metatarsal. And then here the joint on the sesamoid. So that's then the hammer toes procedure. Now we'll do the bunion procedure, which involves straightening the big toe and then moving at the level of the joint over hallucis longus extensor, like so, and then little moves around the joint as if to massage the bone itself, taking the movement of the skin to really press in to the joint. These areas can be quite sensitive, so be sure that you're not hurting, especially when you hold the toe. Don't hold it on the sides, just hold it at the joint from the top and the bottom. Now we're going to flex the joint by separating it and using the thumb as a fulcrum, like so. Thumb tips are right underneath the joint, and we just stretch the joint open. Okay, so now the ankle tape. I've just paused the video, and it probably was a bit of a blur for many of you who've never seen the procedure. We'll be going through the details of the ankle procedure itself shortly. And just so everyone knows, the video will be posted that you can follow very clearly and slowly, along with handout sheets for all the procedures that we would cover today. So you're not going to be left hanging without resources. So to get back to the taping, just so you see it, and it has some context then for when we talk about the procedures. Great. I'll prepare a couple of pieces. In this case, the pain is on the medial side, so we're going to work from the lateral side towards the painful side and give the support to the ligaments on the medial side. So the first piece is a stirrup. It's going to wrap around from the outside to the inside. We're going to lay the tape like so above the ankle joint. And we're going to be able to stretch the tape around the heel, squeezing the joint as we go around it and wrapping around to the medial side of the leg. So now this medial side is shorter and tighter. So a secondary piece is to lay the tape on an oblique angle this time, starting from the front of the leg. We're going to wrap around the heel using the stretch of the tape to pull the ankle into eversion, like so. And then this piece can wrap around and secure the ligaments like so. So a couple of things to notice: that the ankle is at 90 degrees, the foot is flexed inwardly, and now this tape will hold it and protect the ligaments that are strained, just as if a sling. So I'm going to put another piece around the leg just to hold the tape in place so it doesn't peel off. And this tape is from Trainer's Choice, and it's excellent because you can actually get it wet. Oh, yeah. Mm-hmm. So now we'll do another piece prepared for the hammer toes. One and two. And this piece you can cut so that it takes the shape of the toes. A little curvature like that. And now we position it at the web of the toes on the metatarsal, and then we can stretch the metatarsal pad, really pulling tight the, Now we can take this final piece and wrap around like so to secure it. Now there's a bare patch, and what I like to do is take a piece from the lateral side and pull up on the arch so that it accomplishes two things. One, to protect the skin, and two, to support the arch in a more neutral position for the alignment of the ankle as well. So this piece just secures the foot by wrapping around from the outside to the inside. So now we've got the foot in secure tape, and wearing this for a day or two or even longer will support the alignment of the feet. And that's it. Good. Okay, so I hope you got some value from the video and that you could hear it okay. I know sound is an issue, and I hope to have that resolved with my next webinar. But it wasn't too bad, I hope. Okay, and so now we're going to look at a little bit of background about Bowen Therapy and Tom Bowen, who developed it. He lived from 1916 to 1982, and he really is the founder of the therapy. And there are many, many different schools of thought around Bowen Therapy these days, but primarily, there's a lot of similarity, and I think that's important to always note that, how similar the method is between practitioners, and even regardless of which school they came from. So it's a wonderful therapy for that reason, because it is so similar. It's something you'll go to different parts of the world and attend different therapy and different therapists' offices and end up having very similar treatments. So it's exciting to see that happening around the world. The therapy is unique, not because of the way it's done, but for the results. And I think that it's very hard to create a new idea about Bowen Therapy. I prefer to explain Bowen Therapy as a form of body work. It is a form of body work. We actually are hands-on, working on the body. You could see that the therapy working on the feet is very structural. And so that's plain and simple body work. It's not the way it's done or how it's done that matters. It's how effective it is. And in truth, I think for most practitioners around the world, that the average number of visits that they will have with a client is 3 to 5 visits. It's really quite normal to have a problem like sciatica or like hamatoes and see them 3 to 5 times. It's obviously the body goes through a lot and will need further treatments for other ailments that come up or relapses of the same ailment that was relieved, but it's not an ongoing treatment for most people, and that is very unusual. So in a Bowen Therapy treatment, the therapist manipulates the structure with gentle challenge and then releases the tension created by that challenge to send a signal through the area being addressed. And it's because we're sending a signal that we take short pauses of time to allow the body being worked on to respond. And I think without those pauses, there'd be no great effect. It would just be another form of body work that would feel good at the time. But Bowen Therapy has a much more profound impact on most clients, where the effects of the treatment are ongoing through the days following the session. And what the patient might see right there in the treatment session, and definitely following, are that the inflammation that they're stuck in, the nerve response that they're holding in their body, the patterns of reactivity are switched off by the therapy and the pauses between the moves that are done. So I'm not sure if everyone has had a Bowen Therapy treatment, but it's a wonderful therapy. It's extremely, extremely relaxing. And for chronic problems, there's nothing better. It's a profound experience. So in working on the body, the muscles aren't rubbed or overworked. They're just simply stimulated. Now, you noticed when I worked on Linda's feet that the moves were very small. I hardly worked on them at all. And that's because not only was I working on ligament or muscle or the joint alignment, I was also working on the nerves in the area. And what we're hoping for the nerves to do is to reset the way they govern the muscles' function. And that's a pattern that is often chronic and can be reset. And Bowen therapy is a wonderful tool to do that. In fact, if Bowen therapy doesn't work, it's usually because there is a structural problem that really does need a surgical intervention. We also affect the fascia, and that enables a lot of improved function around the muscles. And we see that the body just changes shape, and the joint alignment also follows that change of structure from the lead of the muscle and the fascia. So in the nervous system, we see that the sympathetic state of reactivity that a person is in, that fight or flight state, is switched to a sympathetic one, a parasympathetic one. And this is where the body can heal and recover. And that's essentially what you're doing with the treatment, is enabling the body to simply repair in the way that it could and should repair. You know, when you were 10 years old and you sprained your ankle, you know, it just got better. And yet we turned 50, and that's my experience. And my ankle doesn't it doesn't heal so quickly. It needs a little support and help along the way. For most people, the first visits are often the most profound in a Bowen therapy session, because in a sense, the session itself is so effective at turning off the inflammation and just the emergency state the body is in, that it's one of the most profound anti-inflammatory experiences a person could enjoy. And first visits are really wonderful. Following visits are different, because we're able then to go a little deeper with the therapy and start to really move structure, which isn't always as comfortable as you would hope. Sometimes the alignment of the body has to revisit its problem to resolve it more effectively and correct itself. So one of the benefits of being a Bowen therapist is that you can schedule people in multiple sessions at the same time. And this is a day in June, Wednesday and Thursday, where you can see that I saw multiple patients at the same time. And it obviously gave me time for my family. It lowers my overhead in terms of rent. Bowen therapy is very easy for use as a therapist, and it's also easy for the clients. The benefits are very immediate as a patient. Most people will know very, very quickly if the therapy is the right approach for their problem, and it enables you to really go to the source of where their greatest need is. And I think the very fact that pain is such an imperative for clients to call you, and the fact that Bowen therapy is such an effective pain treatment enables you to really build your practice very effectively. So now we're going to look at some of the pathologies of the feet and look at some of the things we can treat with Bowen therapy. And we'll see that Achilles, a tendon rupture or strain of the Achilles tendon, the calcaneal tendon behind the heel, is a common injury. And Bowen therapy in totality is a wonderful and effective way to address this problem. You should expect tremendous results. Flat feet, I think you could see from the demonstration how the treatment and taping would affect the pronation and fallen arches of feet. And that's also because we've addressed always, when we work on the feet, the pelvic and sacrum and the knee alignment. It's a kind of a system that we would address. Bowen therapy is wonderful for treating arthritis and gouty joints. As an anti-inflammatory, it's tremendous. Corns and calluses, we affect these by changing the way the alignment is and the way we're aggravating the skin on the feet. This is hallux limitus, and this is basically a stiffening of the joint of the great toe, and it turns then into hallux rigidus. I think it's probably much easier to treat the hallux limitus. It's kind of like a bunion, and you will be looking at that procedure shortly. Treating hamatoes, this is very exciting to see the changes in hamatoes, and it happens very, very quickly. So expect great results. Heel pain, heel spurs, again, these are caused by the way we stand on our feet, and this definitely is contributed to by the alignment at the hips, the way our spine sits in our sacrum, and the way the spine and the sacrum is positioned in the arch of the pelvic structure of the hips. And that alignment affects you all the way down to your feet. So you have to address both when you have these types of problems. Stress factors, really wonderful anti-inflammatory effect again. Morton neuromas, pain between the joints of the toes, the metatarsals, and we use basically the hamatoe procedure. Plantar fasciitis, pain in the arch of the foot, at the tendons as they attach at the calcaneus. I mean, we're going to see that procedure as well. Expect tremendous response there. Posterior tibial tendonitis. This is actually what Linda was talking about in the pain at the ankle joint. That tibial tendon was very inflamed, and perhaps the nerve as well, the tibial nerve. Sesamoiditis, which is inflammation under the joint of the great toe. Synovitis. This is especially of the heel, the inflammation that can be relating to different forms of arthritis. And it raises the issue of what happens when Bowen therapy doesn't relieve a symptom. It gives you a fast feedback, and you can then refer on with some clarity about the issue. Synovitis is something very important to look at in terms of what it might be diagnosing in terms of arthritis throughout the body. And so sometimes you might not get a result, especially with heel pain and other areas of inflammation, and need to find out what's going on more clearly, and a visit to a rheumatologist for a proper diagnosis would be indicated. And tarsal tunnel syndrome, which is what we talked about with Linda's heel pain, ankle pain. So plantar fasciitis is extremely painful and excruciating, and this therapy will give relief immediately. We'll be learning how to do taping to support the treatment, and the words will be, it feels fantastic with the tape on. And so using the tape is a kind of a sling to allow the tendons to repair. We'll be looking at bunions and hamatoes, and here you see some pictures of these conditions. And I think the one in the middle that's interesting is that quite likely that's not a painful bunion. That's probably just a deformity, and you won't achieve so much in resolving that. That's a lot of work for not a lot of benefit. This is why a video like this is so useful for clients. They could do the treatment on themselves to maintain the alignment of their toes and relieve bunions and the inflammation in the joint. Often when you work on a bunion, you'll aggravate the problem, because the inflammation that's created there is protective, and you're going to break that away and create some area of pain. Hamatoes, essentially what's happened usually is that the arch of the foot has fallen, the foot is pronated, and the toes are clawing to maintain balance and function of the foot, as if to push the arch into the toes. And this is something that you could see in the video very clearly, that we pull the metatarsal pad backwards towards the heel, and thereby straightening the toes. And at the same time, the joint, the arch of the foot is refreshed. And because we've worked elsewhere in the body, the hips and the knees, these areas improve a lot. Here are some of the ligaments that relate to the arch of the foot and the toes themselves. So on the side, you see peroneus brevis, and that is a tendon that comes down from the side of the leg all the way from the knee, and it governs part of the arch in the foot where it attaches. And then on the opposite side, you have the tibialis tendon, and this is also coming from a muscle in the calf, below the calf, attached at the knee, and it wraps around under the foot, and it's a very intrinsic part of the arch and the alignment of the bones of the feet. So this is why we work in and around that area, and also do a prerequisite of treatment with the knee. So here we're going to look at some of the posture and its effects on the feet. So for sure, I've mentioned already the misalignment in the hips. We can see that with leg length discrepancies, low back pain, sacral iliac pain, knee injuries, arthritis throughout the body, anywhere, in the feet, in the knee, in the hip, in the low back. This can all cause some form of derangement of the posture. And we have a lot of solutions with Bowen therapy for that basic core alignment of the body. And the lower back procedure is sometimes called the basic relaxation procedure, because it is so intrinsic to everything we do, is how to relax and realign the low back and the upper back when we work on that as well. But the pelvic procedure, the sacrum procedure, and the coccyx procedure are a trio of miracle workers, really. They are probably the most effective treatments available. It's amazing that Bowen therapy is only growing as fast as it is. These are incredible tools. I mean, it's miraculous what they can achieve in terms of alignment and posture, from sciatica treatment to chronic low back pain to hip inflammation bordering on an arthritic situation in the hip joint. So we have those as tools, and these are primary treatments for any therapist. And they're simple. They're simple. You saw how the footwork was. These procedures are equally as simple. And just as a heads up, this is the area we'll be looking at the next webinar, I think. But also to mention, other areas that we use are the knee procedure and a procedure called rectus femoris, which are the quadriceps of the front of the thigh, and the hamstrings, the back of the thigh and the calves. These are also affected by the treatment. So in totality, we have a way of refreshing the whole body, and these procedures can be done in basic treatments. This is a screenshot of the pelvic procedure, and just to give an idea of how simple it is, there are actually 4 moves on each side of the body. Very simple movements over muscles and ligaments, and a small articulation and movement of the hip joint, and that's done. It takes about 1.5 minutes to do. So these are, of course, important tools for the way we stand on our feet, to address that from the hips. And this is how simple it is. Here's a view of some of those muscles that we would work on in the hip joint. And so there's a lot of important structures that can be completely refreshed. And when these tendons and ligaments are reset by the effect of Bowen treatment, the joint actually follows suit and realigns alongside it. So there's a lot of enormous potential for treatment with these therapies. This is another screenshot of the sacral procedure, and this is done in even less than 5 seconds. It's incredibly fast, and this will treat most people's lower back pain after any kind of therapy where they get up off the table and feel a little bit tight and stiff in the sacrum area. And it's a very useful procedure because it allows the sacrum to move inside the arch of the pelvis. And this has to happen for the lower back to fully correct its position. And, the sacrum, I describe it to a lot of people as if they're a car with a wheel out of alignment. And the sacrum is the steering wheel of the body. And when their wheels are out of alignment, they have to pull on the steering wheel on one side. And of course, it gets tired. If you've ever driven a car with one wheel out of alignment and you have to hold down on the steering wheel to keep the car straight. And that's what our body is doing. And it's doing it right from this center of itself in the sacrum. So just on a structural level, this is an instant benefit to anyone who receives it, and it's applied properly. So lots of excitement for you to use this. Here are the reasons that is so effective. We can see that there are strong ligaments attaching from the sacrum through to the pelvic floor. And without releasing those and the imbalance in them, the hips can't move and the sacrum can't realign itself in the arch of the pelvic bones. So, or the ilium, as we call the pelvis at that point. So the sacrum is kind of wedged into the ilium of the pelvis, and these ligaments grip it and hold it. So releasing these allows the sacrum to realign itself, and it's very commonly rotated, tilted, and needs to be addressed. So let's look at the anatomy of the feet, and I'm going to see first the large tendons that support the arch of the feet on the side of the leg, and where they attach from the knee down through to the arch of the feet. So on the lateral side, you have peroneus, and on the medial side, the tibialis posterior. And these are like stirrups that hold up the arch of the feet. And you can see how they attach onto the different parts of the bones of the feet. So let's look at some of these. And underneath, you can see that now, both of those big tendons, a little bit of anatomy for you. And here's some description of the bones of the feet. We see the talus above the calcaneus. The next joint down is the navicular, and on the other side cuneiform, and then the metatarsals. And a healthy foot has to function properly. It cannot use the toes as a balancing act. It has to have a rhythmic movement of hitting the heel, and then the next part of the foot has to be on the medial sesamoid, and there's an arch between the medial sesamoid and the last metatarsal of the small toe, and that's also in an arch. So our feet are a bunch of arches that function as propelling system. And when the toes are deviated, this in turn deviates the alignment of the knee and the hips and so on. And as I've said before, vice versa. So people with foot problems, automatically I'm going to work on their hips. People with hip problems that have misalignment in their feet, automatically I'm going to work on both as well. So it's very simple, very simple. Here are some of the tendons we'll be working on. And you see the tendon that attaches to the big toe is the extensor hallucis longus, and the area that we'll work on for a bunion is at the first metatarsal joint. The small extensors in blue for the other toes, they also get affected when we work on the hammer toes and the ankle procedure. So these tendons, of course, have the potential to hold inflammation, just as if muscles. And here we see the plantar muscles. There's a trio of them, and these are often inflamed at the heel where they attach. And you can sometimes have pain and further forward in the arch of the feet, where they also might have tension and inflammation, and at the toes. So with this method of taping that you'll see in the video for plantar fasciitis, we actually create a sling that supports these tendons and allows the foot to function, to be stood on and walk around and even run without aggravating the inflamed tendon attachments of these muscles. So it has a chance to heal, and it can work very, very well. So I'll quickly go through the ankle procedure. I mean, this is a tricky question for me because it's a question of how detailed do I present the procedure. And I'm going to do it in a half manner and not be so detailed, because it's a lot of information to take in a webinar. And whatever is shown here and the procedures that are on video will be available to anyone who attended the video, the webinar. And also the very detailed descriptions will be on the Bowen-Online website, where you can review those procedures in much more detail. So I'm going to go through these quite quickly. And move one is the movement over the ligaments, or the tendons rather, of the toes at the ankle. And we do a medial move, which is towards the big toe. We go over them with one finger and more or less pluck them. With the side of the index finger, we're going to go through these ligaments and stimulate them. You see the ligaments in sort of an ivory color, and the white grayish color is the retinaculum, a sort of sheath. Now, this is the outside of the ankle, and you'll notice in the video that I worked on the inside of the ankle, because that was where the pain was, and the tape that we used shortened the ligaments and gave support to them on the painful side, whereas the majority of people that have an ankle problem have the pain on the lateral side, like this is showing here. So in that case, we would use the tape to support the lateral side, and we would just simply start from the medial side. So this is just to show where the move is made, how big it is, and you'll be able to see this in the handout sheets, and also be able to watch the video to see how the fingers are positioned and so on. This is the opposite side, the medial side of the malleolus, the ankle bone, and this move is made over a group of tendons, and is done with the thumb pad. So where we did moves 2 and 3 is 5A, where we did move 4 is where we see the pink mark for 5B. We simply keep our index finger on the point where we did those moves for 5A, and we keep our thumb on the same spot for the move 4 as 5B. Move 5 itself is the flexing of the ankle joint as fully as it will go, and then a final shove while maintaining a little bit of pressure on 5A and 5B. And this helps sort of open up the ankle joint like an adjustment, almost like a chiropractic adjustment, actually. So these are some more pictures that you'll see on the handouts, and again, just simply showing where the moves are. So this procedure can be done as part of chronic treatment, or it can be done in an acute situation where someone just rolls over their ankle, and that happens all too often. So knowing this and having a resource to even do this for yourself is a wonderful, wonderful tool. I remember being on a camping trip, and after a long drive and getting to the site, we got out of the car, started to play Frisbee, and I unfortunately rolled over on my ankle through a hole in the grass, and had an incredibly bad ankle sprain. And I used this therapy with some tape that I salvaged, and some anti-inflammatory ointment, and some homeopathic remedies. And within 2 days, I was rock hopping with the kids. And so, you know, it just works so quickly. I mean, I had the kind of injury that the whole foot was black and blue from the burst of blood vessels even. So it was a very severe injury, and it really repaired very, very quickly. So the taping, we saw that in action, and these are the pictures you'll have as part of your handouts to be able to follow and hopefully decipher. It's not so simple, but if you read the instructions and go through it carefully, you'll be able to do it. In Bowen Therapy, we also work on the hamatose, and we talked about that. These are the slides you'll be able to see for the procedure. And just a couple of notes. The move 1 is done with the thumbs. Move 2 is the predominant effort, and that's why the arrows on the ball of the foot are much stronger than the arrows on the top of the foot. The fingers are below on the sole of the feet, and the thumbs just sit to support the movement of the fingers, which are tractioning the skin over the muscles and moving the joint and just sort of massaging through the muscles to the metatarsals towards the heel, so as to break up any stickiness and adhesions in the muscles of the metatarsals. So the taping is very, very simple. We saw it in action. It's a simple piece that is attached at the web of the toes, just on the ball of the foot. We traction the toes using the stretch of the tape towards the heel, and then we simply wrap a piece around the ball of the foot to secure it. And be careful not to squeeze too tightly as you wrap around the toes. We don't want to squeeze the foot. We just want to hold the tape. Plantar fasciitis is a wonderful procedure because it creates that sling that comforts the tendons of the feet. So we start out just as if we're doing the hamatose taping, but this time we wrap the tape all the way around the back of the heel and then back towards the toes. So we start at the toes, go around the heel, and then go back to the toes, and then we do a final piece to hold the single strip of tape at the ball of the foot. So this, almost like a ribbon, creates a sling, just as if you were wearing a sling to hold up your arm. This tape will hold up the plantar muscles and give an incredible amount of comfort. So lastly, the bunion procedure is to essentially break up the inflammation in and around the joint. And we do that with a single move over the hallucis longus tendon at the level of the joint of the great toe. And then we do little moves through the skin onto the bone, as if we're doing little massage type moves on the bone. And we do that throughout the joint, wrapping around to the underside. And then we do these little movements to mobilize the whole joint, wiggle, waggle kind of thing. That's numbers 2 and 3. And then finally, we're going to hold the toe and the foot with our thumb tips touching underneath the joint, and then we flex to stretch the joint. We don't bend the joint so much as we stretch it with the tips of the thumb kind of holding that. And there'll be more video for you to see that precisely. Here's some Bowen suppliers, and this I can leave up for a minute or two and give you also a chance to ask some questions now, if you can. I haven't had a chance to look at the screen to see if any questions or concerns have come up, so I apologize if I've missed anything. But I want to just mention that I did use trainer's tape in the video with the live case, and that's my new favorite. It's great stuff. Trainerschoice.ca. I'm sure it's available elsewhere. These tapes are all 3-inch. If you can only find tape that's 1.5 inches, just take 2 strips and join them together, and that'll give you enough stretch. This is the second tape is the AC tape from this company, Henry Schein. It's Very, very good tape, but it's becoming much too expensive to use practically. That's the buff-colored or natural-colored tape that you saw in one of the videos, or you will see in one of the videos, rather. And another mention is Iodex ointment. You'll see that also in the videos. This is a little ointment that is available in Indian grocery stores. They have it behind the counter sometimes, where you'll see Tiger Balm and Vicks Vapor Rub, that sort of thing. And it's a wonderful ointment that will help dissolve calcification in the joint. It's very anti-inflammatory as well. This is a product called Joya Toes, which is sort of essentially latex toe spacers. This can be very useful for working with bunions as well. So lots of information. We haven't covered everything, but there's a whole world of possibilities for working on the feet. Here are some resources for anyone who would like to experiment with Bowen therapy and have a treatment. These are 3 websites where you can find practitioners, and the website at the bottom for training is my site. It's the Bowen-Online website. And that's the slideshow part of the presentation. I'm going to quickly show a video of the plantar fasciitis taping. I think it's this one, so we'll give it a go.
Now to do the bunion procedure, we take the great toe.
This is the bunion, of course.
The finger and the thumb. And we're going to traction it straight so that this hallucis longus tendon is tight. And we're going to make a medial move at the first joint, like so. That's move 1. Move 2 is made with the tip of the thumb. We're going to do a series of little maneuvers around the joint between the seam of the toe. All the way around, and we can do this twice. This is to break down any calcification in the joint. When treating a bunion, it's important to have the client soak their feet to help break down the calcification in the joint. Now we're going to flex the toe with a brace of the thumb pad holding the underside of the calcaneus and the fingers on top to break it open comfortably. So we keep the joint tractioned and flex it open like so. It's also important to loosen it like so in every direction.
So that was a quick video of the bunion procedure, and there's one more that I'll show. This also reads bunion, but it's not. This is the plantar fasciitis procedure, and it just takes a minute. So
here we've got a piece ready to be used with the tape curved around for the shaping.
Just to mention that that little jar beside the client's leg is the iodex, and in the website I do talk about that in detail.
Toes. I'm going to now guide the tape so you can relax your foot. Your client relaxes their foot, and you pull and guide at the same time. So making sure you've got the tape securely at the toes, or the web of the toes. And I'll just repeat that so it stays on. So here the toes are positioned, and I'm going to just gently guide the tape towards the heel, positioning it like so, and then pulling the second piece all the way around from the heel, wrapping it around the heel, and then guiding it back towards the top of the toes. This last piece will secure both ends of the stirrup and simply wrap around like so. Any pieces of excess tape can be trimmed like so. And here, that will stay on pretty well. So that's it. That's then the hamatoes, the plantar fasciitis, and that will hold these muscles supported. So any of the strain that the client's feeling of injured tendon around here will be supported, and here as well, and allowing the treatment to take effect.
Okay, so just I'm going to now go back to the site. I'm so sorry about the echo. I see there's a message about that. I hope everyone could survive the sound. There weren't too many messages, but I'd like to open it up now to any questions that you might have had during the session, and hopefully I can answer them. So I'll give everyone a chance to do that. It should be straightforward. And there's also, while we do that, there's a questions I've had prearranged for you, and that's simple questions such as, you know, have you ever had a Bowen treatment? And you can click yes or no. There are a couple of these. I'm going to give you another question also. Oh, I'm sorry, I go back to that first question. So you can have a go at answering that. I also have a link that will display when when it shows up that there's a link there to a website page that has the videos, that has the downloads for the handouts, and you'll be able to go to that from this link itself, from either pressing gold or pressing the check it out page. And hopefully you can see that. I'm going to go back to the chat and see if there's any questions. So yeah, some of you did have problems with the audio and others didn't. So I'm very glad that that wasn't a problem. It is very challenging to do a video webinar, my God. I can see why most people just do a slideshow and talk their way through it. I'm not even sure how long this was. Actually, only an hour and 7 minutes so far. So that's great. I feel that was really an appropriate amount of time. And I look forward to getting some feedback. So any questions at all, please let me know. I'm going to give a couple of minutes more and let you all have a chance to respond. Good. So some of you have had Bowen and others have not. And then I've got another question for you, and that is whether you're actually a Bowen therapist, because I know a lot of Bowen therapists did sign up for the session, and I'm just curious about that as well. Okay, great. Well, let's call it a night or a day, depending where you are. And I want to thank you all very, very much for attending. And I do hope that you got something of value from this. And oh, I did have one thing more to show you. And I'm going to then share the screen. For those of you who have not seen the Bowen-Online website, there's a lot of incredible information there. And so I shall go to that site now and just have a quick look at it. So bowenonline.com, and don't forget the hyphen, is a website providing live class schedules, online classes, and a lot of good information about this. There is a page of free webinars and videos, but primarily it's a place where we would look for really detailed information about the procedures. So I'm just going to log in now and show you what it looks like from the position of a member. And it's a bit slow, I guess, slow internet because of the activity of the webinar. But I'm already a member of the gold content, and it gives me takes me straight to the content page for the membership level that I have. And here we see on the left all of the procedures that I may want to review. So, for example, let's go to this one, the rectus femoris procedure. Relates to the knees and the hips, and of course thereby the feet. So here we see a page where there is several pieces to it. There's, for one part, a display of the manual instructions for the procedure, and we can zoom in on this and make it larger and see the instructions for the procedure. We can then have a download sheet of the procedure itself, and you'll be able to print that off and have a mini version. We can also then watch a video of the procedure, and this will contain a description of the procedure, all the structures that we're going to work on, and it can also be welcome to the rectus femoris procedure, and so on. And so it'll give all the information necessary for that procedure. There was something else I wanted to show, but anyway, I've lost that. So I do hope you enjoyed the webinar, and this is something that would be of interest to you. I think it's a wonderful tool. I've enjoyed working on this very, very much, and there's a lot more to share. So, one of the other things that the members have are downloads, and they actually get to download the manuals as part of it. So thus far, manuals 1 and 2 are available, and these are really detailed instructions for the procedures, and those come included with the membership for Bowen-Online. I'm going to go back now to the webinar and actually show you the manuals. That they're 4 manuals, in fact, that 1, 2, 3, and 4 are available online, and the others, modules 5 and 6 and 7 and 8, are separate manuals, so but aren't online yet. And I don't think I'll intend to put those procedures online, because already with what's there, it's enough for anyone to have a tremendous amount of success with the therapy. Okay, well, wonderful. Thank you so much, everyone. I'm going to put this back on the screen and let everyone go to where they need to see the handouts and the videos that are on YouTube. So they're high quality, and it'll sound and look a lot better than you saw here. So thank you very much, and have a good day. Bye-bye.